Hola amigos, feliz viernes. Hoy es viernes. Yo soy Rory. Estoy contento estar aquí contigo. One of the questions we get all of the time in our online medical Spanish courses called Mastering Medical Spanish is, Rory, what's the difference between dolor and duele? I know it has something to do with pain. I know people are talking about what hurts, but I'm not sure I could use them differently and be confident that I'm using them correctly. Another common one would be hinchado and hinchazón, which, Rory, I understand they both are referring to some kind of swelling or something, but how do I know when to use hinchado versus when to use hinchazón? Well, the good news is the difference isn't too difficult to understand. We're going to take a look at it today. And to help us, we're going to look at verbs, nouns, and adjectives for injuries in Spanish. Let's take a look, starting with tres verbos importantes, tres verbos útiles. We've got tener, estar, and sentirse. Tener is to have. Estar is to be. To be, in our context today, related to like a condition or the state that something is in currently, okay? And then sentir, to feel. Sentirse, to feel in yourself, like often an emotion or a symptom or something like that. Okay, so let's take a look at las conjugaciones de tener. So yo tengo, tú tienes, él, ella, usted tiene, nosotros tenemos, and ellos, ellas, ustedes tienen. Okay, so I have, you have talking to a child, él, ella, usted, he, she, or you, adult has, nosotros tenemos, we have, ellos, ellas, ustedes, they, or ustedes, which is y'all, have. All right, let's take a look at estar. Estoy, yo estoy, I am, tú estás, you are, talking to a child. Él, ella, usted, está, so he is or she is, and then usted, you, for an adult, are. Nosotros estamos, and ellos, ellas, ustedes están. Moving on to el verbo sentirse. Yo siento, I feel, yo me siento, for using the reflexive version, me siento. Tú te sientes, él, ella, usted se siente, nosotros nos sentimos, ellos, ellas, ustedes se sienten. All right. The trick here is las frases to describe injuries and wounds, and like dolor, duele, hinchado, hinchada, they're going to use gramática diferente. Let's take a look at some ejemplos aquí. So, empezamos with tener y sentir. They're all going to take a sustantivo, so some sort of noun. Let's look. El paciente tiene hinchazón en los tobillos. The patient has swelling in the ankles. Okay, hinchazón, the noun, swelling. Pero él no siente dolor, but he doesn't feel pain. Los tobillos no le duelen. The ankles don't hurt him. Okay, so here's the verb doler, duelen, hurt. That's the verb. Dolor is the noun, pain. And so we've got tener and sentir with the noun. So tiene hinchazón, has swelling, siente dolor, feels pain. Okay, bien. Estar and sentirse, however, go with the adjective form of the word, okay? And so, los tobillos están hinchados. Whereas here we said the patient has swelling. Now, the ankles are swollen, están hinchados. El paciente se siente preocupado. So preocupado is a completely different adjective. We didn't see it up here. Preocupado is the adjective worried. So el paciente se siente preocupado. The patient feels worried. Okay? All right. And one more construction. También es posible usar tener with the body part and the adjetivo. So kind of a combination of these two here. Let's take a look. El paciente tiene los tobillos hinchados. So the patient has not just swelling now, the patient has ankles swollen. That's how we do adjectives with nouns, right? So we always do the noun first. So the patient has swollen ankles is how we would say this frase in inglés. El paciente tiene swollen ankles, tobillos hinchados. Okay. What's going to help is to see these words lined out as the verb form, the noun form, and the adjective form. So that's what we're going to do. We're going to take a look at el verbo, el sustantivo, which we'll use with tener and sentir, remember, and then el adjetivo, which is estar and sentirse. Okay, so let's get started. Abrir. Abrir is the verb to open. okay? Abertura would be like an opening, think of like a gash or an incision or something like that. And then the adjective abierto, okay? El verbo amputar, to amputate. Amputación is the noun and amputado would be the adjective. Confundirse or confundirle. Confundirse is to get confused, like somebody gets confused. Confundirle would be referring to more of like a situation confuses him or confuses her, etc. So it's not reflexive in this case. The noun confusión and then the adjective confundido or confundida. Now all of these could have the O ending or the A ending depending on whether the thing they're describing is masculine or feminine. And we're not talking about the gender of a person. We are, but not only that, we're talking about every word, every noun in Spanish has a gender. It's either masculine or feminine. So like cabeza is la cabeza. So if we were to describe la cabeza abierta, for example, like a gash on their head, la cabeza está abierta, then it has to be abierta. But if it's el brazo, it's masculine, el brazo amputado, for example, or abierto, like a gash on the arm. Okay, you get it. Cortar is the verb to cut. Cortada and cortadura are nouns for the word cut. And then cortado is the adjective cut. This gets confusing because in English we just say cut. And cut is our verb, cut is our noun, and cut is our adjective. And so we say cut this, cut that, verb. He has a cut, noun, and then something is cut, adjective. That's what's confusing. If you try to have an English equivalent always to a given word, you may come up short because cut can be 3 different words in Spanish depending on the type of speech that it is. Okay, let's keep going. We'll probably see more examples of that. Desgarrar. Desgarrar can be to strain or to tear, okay? So un desgarro or un tirón would be like a strain. So think soft tissue, think muscle, think ligament, that kind of thing. Desgarrado or desgarrada, strained or torn. Dislocar, to dislocate. And then the noun dislocación, adjective dislocado, dislocada. Dolerle is the verb to hurt. Here's where you get like me duele la cabeza or le duele la garganta, does your throat hurt, etc. This is the verb to hurt. But dolor is the noun, pain. And then adolorido would be the adjective like sore or hurt. Yeah? Okay, bien. Fracturar, to fracture, fractura, fracture, and then fracturado, fractured, the adjective. Okay, continuamos. We've got a couple slides of this stuff because there's a lot of common words to describe injuries that you want to know, okay? So hinchar is the verb to swell, hinchazón is the noun swelling, hinchado then is the adjective swollen. We saw that example previously with the ankles, right? Infectar, to infect, infección is the noun infection, and then infectado, the adjective infected. Inflamar, very similar. Inflamar, to inflame, inflamación, inflammation, inflamado, inflamada, inflamed. Lacerar, lacerate. The verb to lacerate, laceración, laceration, and lacerado, lacerada, lacerated. See? Magullar is an uncommon verb, but it describes a really common sign in medicina. It's bruise, to bruise. So magulladura is a bruise, and then magullado, magullada is the adjective bruised. Okay? Marearse. Marearse. Here's another really common one that you hear mareo and mareado in the clinic, but you're like, oh, how do I use these differently? Okay, marearse is the verb to like get dizzy. Mareo is dizziness, and mareado is the feeling of dizzy. Here's a great example where we would use, so, tiene mareo or siente mareo, okay? And then, está mareado o se siente mareado, okay? So we can use these verbos differently con los dos diferentes tipos de speech, the different types of speech. Morderle is to bite something or someone, okay? Una mordida is a bite, and then mordido or mordida is the adjective bit or bitten, see? I don't even know English. Picarle is to sting, and so picadura is like a sting, and then picado or picada is also a sting. Now, picarle is also the word for bite for an insect. So an insect bite would be like a picadura, but more of a dog bite or something larger would be more of a mordida. Okay? Bien. Okay, continuamos. And it also means to sting. All right? Bien. Continuamos. Quebrar is the verb to break. Quebradura is a break, the noun. Yeah? And then quebrado, broken. Quemar is to burn. Quemadura is a burn. And then quemado is burned. Okay? Muy bien. So you're seeing how this gets complicated, again, if you try to have one English equivalent for every Spanish equivalent, because burn and burn, it's really the same word in English, but they're different parts of speech. Burn can be different parts of speech. It can be a verb or it can be a noun. It's not an adjective because the adjective is burned. That's how we say it, right? But these two, it's the same English equivalent. So you just have to kind of think of, okay, part of speech. Am I talking the verb, to burn, or am I saying the noun, a burn? Exactly. Okay, rasparse. Rasparse is to scrape. Un raspón is like imagine falling off your bike and getting a big scrape on your arm or something like that. Raspado is the adjective then, is all scraped up. Yeah? Romper. Romper is to break or to tear. It's a great word, like desgarrar, for soft tissue stuff. Okay? So romper, like broken or break or tear. Rotura is a tear or a break, see? And then roto would be broken or torn. Okay, continuamos. Torcer is to twist or to sprain. And so torcedura is a sprain, basically. And then torcido is the adjective, twisted or sprained. Okay, bien. Let's take a look at más ejemplos to see how this goes. All right, un ejemplo, con tener y sustantivo. Tener y sustantivo. So we're going to use the noun. La niña tiene una cortada en la pierna. So the girl has a cut on her leg. Tiene una cortada en la pierna. El adolescente, the adolescent, tiene una magulladura en el ojo. So he's got a bruise on his eye. Es un ojo morado. So in English we say black eye, but in Spanish we say purple eye. Es un ojo morado. La señora tiene hinchazón en los tobillos. The lady has swelling in los tobillos. We've seen that example before. El bebé tiene una infección en el oído. So the baby has an infection in the ear. Okay, let's look at these exact same examples, but now we're going to use, instead of tener and sustantivo, we're going to use estar and adjetivo. Okay, so la pierna de la niña está cortada. One thing to remember here, we can't say la niña's pierna está cortada. We can't have that apostrophe S for possession in Spanish. It has to be the leg of the girl, okay? Bien, so la pierna de la niña está cortada. El ojo del adolescente está magullado. Again, same setup. We can't say el adolescente's apostrophe S, ojo está magullado. Can't do it. El ojo del adolescente está magullado. Los tobillos de la señora, same construction. Los tobillos de la señora están hinchados, are swollen. El oído del bebé, again, same construction. The ear of the baby está infectado. Está infectado. Bien. Now, early on in the lesson, I said there's a third way to do it, sort of a combo of both, right? Using tener with the parte, with the adjective. Let's take a look. Those same four examples now in a slightly different way. Now we're going to say cut leg and black eye or bruised eye, etc. Okay, la niña tiene la pierna cortada. La niña tiene la pierna cortada. Okay, so the girl has, and then we have noun adjective, la pierna cortada. El adolescente tiene el ojo magullado. La señora tiene los tobillos hinchados. So she has swollen ankles. El bebé tiene el oído infectado. All right, so all three of these ways to say the same thing are valid and good and easy to understand. Your patients will understand you, no problem at all. Probably you have two goals. One is to be able to understand your patients regardless of which sort of setup or format they choose to use as they're describing something to you. And then the second goal would be to choose one of them that is easiest for you to remember or sort of fits the way you talk and describe things, and just get really good at that one way of expressing a given injury or a wound, okay? But commit those verbs, nouns, and adjectives to memory. Let's do some practice. Okay, la práctica. How are you going to say the leg is fractured? Put me on pause if you want to take a minute to review your notes, look at the vocab, and figure out how you'll say these things. The leg is fractured. Is fractured, you should be seeing, okay, that's is, and then fractured is an adjective. Okay, so you're going to go for that part of speech, the adjective part of speech. The leg is fractured. La pierna está fracturada. Okay, the patient has a burned hand. Okay, all right, so this should be calling up that third combo way of expressing something, because we're not saying the hand is burned. We're not saying the patient has a burn on the hand. We're saying the patient has a burned hand. Give me take a second, put me on pause and think of what you're going to do. El paciente tiene la mano quemada. The girl has a cut on her forehead. The girl has a cut on her forehead. Take a second. La niña tiene una cortada en la frente. Let's do some more practice. He has 3 broken ribs. He has 3 broken ribs. Okay, what are we going to do? Él tiene 3 costillas fracturadas. Él tiene 3 costillas fracturadas, or 3 costillas quebradas. We could use either word for broken. Okay? Bien. Her ear is infected. Her ear is infected. How are we going to do that? Su oído está infectado. Or, el oído de ella está infectado. We can do either one. See? Okay? El oído de ella está infectado. She has a twisted ankle. So she has a twisted ankle. Ella tiene un tobillo torcido. Okay, here's what you're going to do. You need time to practice this. So with your conversation partner, here's something you can do. Choose a couple of conditions that include this injury and wound vocabulary and role play as the patient for your partner. So have relevant answers for the history of the present illness question. So like, how did it happen? How did this happen? How did it start? That sort of thing. Have detailed responses ready for pain questions. Be able to talk about duele mucho, duele poco, kinds of types of pain, things like that. If you want to brush up on this vocabulario, head over to our other pain lesson so you can see how to talk about pain in Espanol. And then don't give them too much info at once. Make them, keep asking you for more and more detail. If you don't have a conversation partner, head over to the Learning Medical Spanish Facebook group and right here. And if you have preguntas, be sure to post them in the comment section below, and we'll be glad to answer your questions for you. Ok, muy bien. Muchas gracias por aprender español conmigo. Juntos mejoramos comunidades para más español. Poke around on the Common Ground website and you'll see tons of medical Spanish blog posts ready for you to continue your learning, etc. And opportunities to join that Mastering Medical Spanish course. Okay? Bien. Y if you want to take un examen de español médico, a free medical Spanish terminology test, head over to certifiedspanish.com, create your free account, and you can get in and take as many free tests as you would like. Hey, thanks for joining me in this lesson today. If you learned something new, make sure you like the video and subscribe to our channel so that you continue to get new video lesson updates as we put them out. Have a great weekend. Nos vemos la próxima semana. Ciao.